Hi guys, it's Dr. Mona, and today I wanted to talk about Skinvive. Skinvive has actually been around for a long time. It was in Canada and in Europe, it was called Volite. And in May of 2023, in the United States, we got FDA approval to use it. I was part of the initial launch with Allergan when this got FDA approval, and it's such an interesting product. It's actually one of my favorite. So what is it? It's not a filler. It's actually an injectable hyaluronic acid that works to increase the water channels in your cells. So think of your cells as kind of just sad little dehydrated cells, and all of a sudden you've created these little water channels called aquaporins. The water comes in and your cell is nice and plump and hydrated. But why is that important? As we know, our bodies are made up mostly of water. And as we get older, we also lose hyaluronic acid and we're a little bit more dry and hydrated. And so what you can notice within 1 month is that your skin is a little bit more glowy, it's more hydrated. And I talk to many of my patients and they say all of a sudden I'm not as dry in the wintertime. I can use my retinoids a little bit better. And interestingly, although this is not on label, I think it actually helps with melasma because that hydration in your skin helps with the inflammation that happens with melasma. So how do we inject it? When it first came out, we were injecting it with little tiny needles superficially into the skin, and that is one way to do it, and you usually use about 2 to 3 syringes per patient. I found that even for myself when I did this, there was a little bit of bruising and you kind of had to manage your downtime. And so now, even though this is an off-label use, I think it's actually safer. I use a cannula, which is a blunt edge needle, so it doesn't actually have a sharp point. And I just spread it all the way around the cheek, all the way around the cheek. And then sometimes if patients have little fine lines, I'll go above the lip or in this area. Well, how long does it last? The great thing is it lasts 6 months. It's virtually a minimal downtime procedure. It's just that one little point here and here that you would have, minimal risk of bruising. And within about a month, you'll notice that your skin is more hydrated, it's more glowy, your products might sit better, and it just feels great. So I like to do it every 6 months. It's an easy thing that you can do on its own, or you could add it on to a treatment. But I think it's almost like you could call it an injectable moisturizer under your skin, like a deep injectable moisturizer that just hydrates your skin from within. So with any treatment, we also say, as before, what are the risks and the benefits? So we've gone over the benefits and what are the risks. Initially, as I said, when we used a needle, well, you could bruise, there's always a risk of occlusion. With a cannula, the risk of occlusion is significantly less. And again, you have just one entry point in an area as opposed to having multiple entry points. The other thing that I think is really important is to know what plane you're in. And again, this comes back to having a skilled injector. If you put it too superficially, you might feel it as a bump. If you put it too deep, you're not going to get the benefit of it. So again, you want to make sure that you're going to somebody who is very comfortable with what plane of the skin they're in and knows the anatomy of the skin to be able to use it. So a lot of people will ask, is Skinvive a filler? It's really not a filler, it's an injectable hyaluronic acid. Can we use it in the lips to improve hydration? Yes. Is it going to volumize the lips? No, right? So again, you're not going to use this product to lift, which if you needed lift because of aging, it's not going to volumize in areas where you might have loss of fat pads like the mid-cheek or kind of around this area of the chin, but it is going to help with hydration. It can actually help with those little fine crinkly lines that we get as we get older because it's placed a little bit more superficially, and by increasing hydration and kind of becoming this plumper cell, that helps to smooth out those fine lines. But it's not really considered a filler, and I don't use it in my practice in that way. So who's a candidate for Skinvive? Honestly, I think anyone is a candidate for Skinvive. It definitely can help people who have drier skin, but if you want more glowy, hydrating looking skin, and who doesn't? I mean, I know I do. I think that's a fantastic product to be able to use. Well guys, thanks for watching. I love any questions that you have. Please let us know in the comments below, and we'll see you next time.